There are multiple graft options for ACL reconstruction. However, overall, there are two major categories: allograft tissue and autograft tissue. Allograft tissue is tissue from a tissue bank or a cadaveric graft. We typically reserve this for less active older patients who are having ACL reconstruction. Autograft tissue is tissue from your own knee, and this is typically the graft option and choice that we use for a majority of our patients. There are three main areas of graft harvest for autograft tissue. The first is the patellar tendon, also known as bone tendon bone. Here, we're taking the central third of your patellar tendon, as well as a part of the kneecap bone, as well as a part of the tibial bone. The second option is the quadriceps tendon. This is relatively newer in ACL reconstruction, but has found success. In the quadriceps tendon harvest, we're taking about 10 millimeters of your distal quadriceps tendon, which is the part of the muscle tendon that inserts on the top of the kneecap. And the third option is the hamstring. The hamstring tendons wrap around the front of the knee at the top of the tibia. Typically in this technique, we're taking one or two of the hamstring tendons and looping them to create a hamstring graft. Out of these three graft options, we'll discuss which ones make the most sense for you. We'll provide an individualized care plan that is most sensible for you as the patient. We'll take into account your age, your activity level, your hypermobility of your joints, as well as your cutting and pivoting sports that you may be involved with. We look forward to consulting with you and helping you through this problem and journey.